So we're going to talk about the anatomy of the heart today. The first thing we're going to mention is the apex. The apex is this pointy portion of the heart right here. Then we have the base. The base is the top, so it includes this whole area and part of the back as well. Then we're going to have the superior vena cava, which is this whole area right here. Then you have the inferior vena cava at the bottom. Then we're going to talk about the aorta. So let me just move it just a little bit so we can see the aorta clearly. Now the aorta is this whole vessel right here, and there's three portions to the aorta. The part that's going up is called the ascending aorta. The part that's curved is the aortic arch, and then the part that's going down is the descending aorta. Let me do it this way. So that's the descending aorta right here. Then you have three branches on the aorta. The first branch is the brachiocephalic artery. Then you have the left common carotid artery and the left subclavian. So again, brachiocephalic artery, left common carotid, and left subclavian. Now I typically tell students to remember Broward College sucks. So the B again is for brachiocephalic, the C is for left common carotid, and the S is for left subclavian. Now we're going to talk about the chambers of the heart, so we're going to have to open it up. So the first chamber we're going to talk about today is the atrium, the right atrium. So that's this one right here. Then you have the left atrium on the left side, and if you notice, this is the superior vena cava, which is always going to be on the right side. So if you have trouble figuring out which side is right and which side is left, just try to find the superior vena cava, and that's the right side of the heart. So this is the right atrium. This is going to be your left atrium. Then you have your right ventricle and the left ventricle. Then we're going to talk about the different valves that we have inside of the heart. The first one that we're going to talk about is the pulmonary semilunar valve. Then we're going to mention the tricuspid valve, which is also known as the right AV valve. And then on the left side, you have the bicuspid valve, which is also known as the left AV valve. And most importantly, for those of you who are nursing majors, you also have to know it as mitral valve, because that's going to be on your nursing or on your entrance exam for nursing school. Next thing we're going to talk about are the cusps. So the cusps are going to be like the top portion of this area right here. Then we have the chordae tendineae, or these cords right here, these strings are called chordae tendineae. And then attached to the chordae tendineae, or the papillary muscles, which are these, are the ones that are going to be attached to the chordae tendineae. So they're both attached to each other. Inside of the ventricles, you have papillary muscles, and then inside of the atria is plural for two atriums, you're gonna call it atria. So the inside of the atria, you're gonna have pectinate muscles. All right. Next, we're gonna talk about the in between the two ventricles, you have the interventricular septum, and that's this right here. And you also have three layers on the heart, which we're gonna talk about in a few. Okay, the three layers of the heart are gonna be your epicardium, which is the outermost layer. Then you have the myocardium, which is the muscular layer. And then you have the endocardium, which is the innermost layer. Does that make sense? Okay. Now, next, we're going to talk about the outside of the heart. So we're going to close it out for now. So we're going to talk about a few vessels. The first one we're going to talk about is the right coronary artery, which is this. The cool thing about the heart is that it's got its own blood supply. And the main vessels that supply blood to the heart itself are the coronary arteries. And again, this is the right coronary artery. And then if you turn to the left side, you have the left coronary artery, which is the red one right here. Now, each of these arteries are going to have branches. The first branch on the right side is going to be your right marginal branch or right marginal artery. Now, if you turn to the back side, you can actually see, let me see if you can see that well. Oops, sorry. So, if you follow it to the back, it leads into what we call the posterior interventricular artery, which is this right here. Now, once you move on to the left side, here's the left coronary artery. Then if you move to the back, you will see this red vessel right here, which is the circumflex artery. The circumflex artery wraps around the heart, and then it's going to lead us into the second branch of the left coronary artery, which is the anterior interventricular artery. Now keep in mind, once you get to the bottom of the heart, or this portion of the heart, the veins are going to be blue and the arteries are going to be red. And once we talk about, oh, let me mention this. The yellow portions right here, the yellow area is called the coronary sulcus, right? Because it's around the coronary artery. And then the yellow portion right here in between the two ventricles is the interventricular sulcus. Okay? Then we have the we talked about, oh, in the back you also have the posterior, let's go back here for a second. You have the posterior interventricular sulcus, which is the yellow portion again. And then we have, the coronary sinus, which is right here. This is a vein, so it's a huge vein. It drains the blood from the heart itself. So it's right above the circumflex artery. And then let's talk about some of the other veins that we have to know. First one is the great cardiac vein. The great cardiac vein is this, right here in the middle. Remember, it's blue. Then you have the small cardiac vein, which is this. And then we have the middle cardiac vein, which is also in the back. So if we flip it, I'm not sure if this is a good idea. So this right here, this one, is the middle cardiac vein. Okay? And then we have, we haven't talked about the arteries just yet, but we'll talk about that in a second. So that's good. For the outside, I think we're okay. Let's just mention, the last things we're going to mention are going to be these two right here. Now, notice I said earlier that arteries are red and veins are blue, and that is true in most cases, except when you're doing this portion here. The arteries in this case are going to be blue, and the veins are going to be red. So these are going to be your right pulmonary arteries, and these are going to be your right pulmonary veins. And then you have on the left side, you have the left pulmonary arteries and the left pulmonary veins. And you may not notice that on the list, but just in case you have to know it, this is the right auricle, and right here it looks like a distorted here. And then this is the left auricle on this side as well. I think this concludes our video. Thank you so much for watching.